Hey, it's Professor Kristen. And so I want to get started on this video, and it is to go over anti-anginal drugs, it says nitro and more. And so I want you to know I'm doing several videos. So this one is going to be on nitro specific, nitroglycerin, and some other of those drugs. And then I will break it down and have other videos for beta blockers, calcium channel blockers, and ACE inhibitors. So let's go ahead and get started. And let me get on this. There we go. So one of the things that I want you to understand is that we are looking at trying to vasodilate because that's what nitrates do. And we're looking usually at chest pain because the drug of choice for acute MIs or chest pain is nitroglycerin. So just so you know, you will see the term angina pectoris, which means chest pain. Move myself over out of the way. It means chest pain. So if you happen to see that, that's what that is. And you will see that probably on NCLEX and in charts, in histories, things like that, just so you understand the terminology. And what is chest pain? Well, chest pain is when there is a lack of oxygen and nutrients in the blood, and it cannot meet the demand of the heart. And so the heart kind of aches. So you have this discomfort. So if we don't have enough blood flow to the heart, or we don't have enough oxygen in the blood with nutrients that can get to the heart, then our heart will start to go, it'll ache, it'll start to have pain because it is an organ that needs a lot of oxygenated blood to function. It's a muscle, so it needs that oxygen. We have ischemia, and you can have different, when things happen with the heart, we can see different things. We can have ischemia, and with ischemia, it's just blood poor supply to that organ. Could be other places too that we can have ischemia, of course. And if we have ischemic heart disease, that means it's poor blood supply to the heart muscle. We see it with atherosclerosis, those hardening. We see it with coronary artery disease. We'll see it with plaque buildup. We see it with the hardening of the actual vessels. I call them crunchy vessels. They just become not pliable. And then, of course, we can have a myocardial infarction where we'll get ischemia, and it'll go from ischemia to injury to death or necrosis of the tissue. And this can be disabling or fatal. And so let me just say this about heart tissue. Time is tissue. We need to get in there, diagnose quickly, and get them the proper treatment that they need to helpfully save the heart. If we have ischemia and we have injury, those can be, the patient can or client can recover from that. If we have necrosis of tissue, the tissue is dead. It doesn't come back from the death, unfortunately, it doesn't come back from that. And so it's non-functioning tissue that's just there, and it can create a lot of issues for our clients. We have different types of angina, and I do want to review these a little bit. We have chronic stable angina, people that just have chest pain upon exertion, things like that. It's a classic type angina that we see, but I want you to understand that it's a stable angina. We're not looking at someone having an acute MI that has this chronic stable chest pain. But if we see unstable angina or crescendo angina, that is related to an acute coronary syndrome. We're having an acute coronary syndrome if we have unstable angina. And that could be possibly an acute MI. So it's so important that we kind of understand what we need to do and how it works. And then we can have variant or Prince metal angina. And when you see that, this is an angina that takes place at night or early morning. People will have chest pain, and it can be caused by chronic stress or exertion. So you will see that too. So if we were educating a patient, it would be important to understand the different anginas so that you can say, hey, this is what you're having and this is what we're thinking. If it changes, this, that, and the other. And then we have microvascular angina. And so there are 4 different types of angina. Question. A patient is mowing his lawn on a hot Saturday afternoon, sweating out there, pushing that mower. He begins to notice chest pain. He starts having chest discomfort, chest pain. What should be his first action? Now, he can take a nitroglycerin tablet. Well, yeah, if he has nitroglycerin, then yeah, that's a possibility, definitely. Should he stop mowing and sit or lie down? Definitely he needs to. Should he go inside the house to cool off and get a drink of water? Possibly. But I will tell you this, for that one choice is don't drink anything at this moment in time, but to go in out of the heat, maybe to cool down would be a good thing. And should he call 911? Possibly. Okay, so let's break it down. The correct answer is to stop mowing and sit or lie down. That is the first thing he should do. Just stop the exertion. The more you exert yourself, the bigger the oxygen demand is for the heart. So if to lower that, to hopefully stop the chest pain, we need to stop the exertion. Then, should he go inside and cool off? Yes. Don't drink water. He shouldn't eat or drink. Should he take a nitroglycerin tablet? If the pain does not stop, then yes, he should take his nitroglycerin if he has one, sublingual, under the tongue. And should he call 911? Yes, he should. So all of those answers are right, but the best or the first response of the client or the patient when exerting himself, if he were working out in the gym, started having that chest pain, he needs to stop. Same with doing lawn care or shoveling snow or anything like that. Stop moving, decrease your oxygen demand. Move myself away. And at the first sign of chest pain, the person should stop all activity and sit or lie down before taking the nitroglycerin tablet. Nitrates or nitrites are available in different forms. So it's something interesting to know. You can get it sublingual. There's chewable tablets, oral capsule tablets, IV or intravenous solutions, transdermal patches, ointments, and translingual sprays. The translingual spray and the sublingual go under the tongue. We have oral capsules and chewable tablets, and those, of course, are consumed and will go through our GI tract, which makes me look down at the bottom of the screen. I'll take my little arrow and point at it. They bypass the liver and the first pass effect. So we can have a first pass effect with nitroglycerin. And that means we will not, if they take it orally and it goes through our GI tract, it's possible they will not get the complete dose. And so that's why we usually do IV and bypass that, or we'll do sublingual, let it absorb, or we go through a patch. But that is definitely something to know about nitrates. I went ahead and put this up because this is something that we have learned in the very beginning of the class. And it's always good to review because it is something that, you know, you hear it, you need to hear it again, you need to hear it again. So the first pass metabolism, or the first pass effect, or pre-systemic metabolism, and you might see it written out like that. But for right now, for my class that I'm teaching, I want you just to know first pass effect is the phenomenon which occurs whenever the drug is administered orally. So it's going to go in through the mouth. It's going to go through the GI tract. With that, it's going to do this whole big metabolic thing. It enters the liver, suffers extensive biotransformation. So it's going to alter itself. And to an extent that the body, the amount of medicine that's going to get into that bloodstream doesn't get there. So you give this amount and what's getting into the bloodstream is this amount. So that is something, it's drastically reduced. So that is something we need to be very aware of. So it's better to just bypass that if you really have a patient that needs the medicine of what you're giving. And knowing that and understanding that first pass effect is going to actually make the physician who is ordering the drug think about the dosage. They're going to have to really think about dosage. But as the nurse, you need to understand is sometimes your dosage might be higher on that first dose and then lower because that first pass effect takes place. Nitroglycerin, these are some nitrates that we have. Nitroglycerin is both rapid and long acting. Isorbide dinitrate is both rapid and long acting. We've got the isorbide mononitrate is primarily long acting. And then we give nitroglycerin first with acute coronary syndrome, which is ACS, or an acute MI, myocardial infarction, which is AMI. So just know they can be rapid or long with nitro, and then also, but the isorbide mononitrate is primarily a long acting. So patients or clients will take that because they need that effect, that vasodilation, a longer effect. But because nitroglycerin is fast acting, it can be, we can give it first, and we definitely give it first, ding, 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 with an acute coronary syndrome or an acute MI. They're going to get nitroglycerin. We want to dilate them. Okay. Nitrates and nitrites, they cause vasodilation because what they're going to do is relax smooth muscle. So we have vasodilation and relaxation of the smooth muscle. Well, the heart is smooth muscle. So we're going to dilate and we're going to relax muscle. And that's what we need. We need things to open up so we can get that oxygenated blood to the heart so the heart can continue to pump accordingly. It's potent dilating effect on the coronary arteries, and we know that. And just by saying that, I want to say this. If I'm going to dilate those coronary arteries, I'm going to lower my blood pressure. It can cause hypotension. So I want to just break that down for a quick second. So if I dilate my coronary arteries, if I have a vessel that's like this, and I have it and it's slowly occluding, and I'm trying to put blood through that, I'm trying to get through that, and there's something blocking it, the blood's not going to flow, is it? It takes more pressure to push it through. And so because of that pressure buildup, my blood pressure is going to go up and the workload of my heart is going to increase. It's trying its hardest because it's trying to survive. So just know when we give the nitroglycerin, it's going to relax and open those vessels, vasodilate them open, and blood is just going to flow through. And because of that, it can cause our blood pressure to lower. So we need to really be careful about hypotension and orthostatic hypotension. And I'll talk a little bit more about that here in a minute. Oxygen to ischemic myocardial tissue, that's what results if we can vasodilate and relax the smooth muscle. And it's used for prevention and treatment of angina. So if they're having chest pain, we can give it and we'll hopefully relieve that. And I am going to just go on record to say this too, is we also have put nitro paste on over, certain areas, hopefully trying to help it to absorb and dilate maybe that area. I've seen that in the ICUs. When do you give it? Well, we use it to treat stable, unstable, and vasospastic angina, so all of the different anginas. It used to be called Prince Metal, now they're calling it vasospastic. It changes. So let's talk about the angina. We have Prince Metal or variant or vasospastic. Those are the same thing, okay? And what that is characterized by episodes of rest angina that promptly responds to short-acting nitrates and are attributable to coronary artery vasospasms. So we have a spasm, vasospasm, our vessel will spasm. We start to have this chest pain, and we take a nitroglycerin under our tongue. It will release and relax that, and it goes away. We see it with stress and some other things that can cause this. So you might see it as variant angina, Prince Metal, or vasospastic angina. So put those three in one little column when you're studying for your boards or you're studying for anything cardiac. Know they're the same thing. We have rapid acting forms. We're going to treat anginal attacks, acute, anything acute, we need it to be treated quickly, right? Think acute. Acute, we need to treat fast. If it's long forming, if it's chronic, then we're going to give them other medications to help that will keep those vessels open so that it will prevent them from having the angina. And that's why we do have those. Thank goodness for science and pharmacology. So let's look at this question. The nurse is obtaining a medication history on a patient presenting with chest pain. What drug classification would necessitate the nurse informing the provider before beginning the prescribed nitroglycerin? A, proton pump inhibitor. B, phosphodiesterase inhibitors, which are your erectile dysfunction medications. Inhaled beta blockers is C, and D is aspirin. The correct answer to this is B. Erectile dysfunction medications are potent vasodilators, and therefore nitrates are contraindicated when the patient is taking this classification of medications. All other medication classifications can be safely used with nitrates. Now, I will say this, if you're worried about your blood pressures and you have nitroglycerin running in a drip form, then you might have to be very careful with what you're doing with those medications. But as far as inhibitors, the potent vasodilators, this is erectile dysfunction medications. So Cialis, Viagra. When patients or clients are taking those, that is a red flag about nitroglycerin, because what's going to happen is that's what those are. They dilate too, they cause hypotension, and you add nitrates to that, and you're going to bottom them out, their blood pressure. It can be lethal. I hope that's clear. So this is another ding, ding, ding moment. So if I'm taking any of my patients in their history that take erectile dysfunction medications, we need to make sure that we're aware of that, make the provider aware of that, because they are contraindicated with nitrates, period. Now, I'm hoping I can get this to work. Oh, I bypassed it. When this actual PowerPoint goes up on Brightspace for you, for my students, you can actually copy that link and go ahead and watch that. It's a great little fun excerpt about Viagra and nitroglycerin. So please watch. Contraindications. If they have a known drug allergy, always, what is the first thing you ask your patients? Do you have any allergies? When you go to give any medications, what do? What is your name, date of birth, 2 identifiers, and ask them if they have any allergies. I don't care if you ask them 25 times in the day. It is the best habit to get into, and you will never give a medication incorrectly. If they have severe anemia, anemia deals with oxygen carrying capacity of blood cells, correct? So if we have severe anemia, we can create a lot of issues. Closed angle glaucoma, hypotension, of course, because all we're going to do is make it worse, severe head injuries, and the use of erectile dysfunction drugs. And there's some more Levitris on there too, just so you know. Adverse effects. We can have headaches, usually diminish in intensity and frequency when continued use. Now, what happens is nitro or nitrates are systemic. So when you give it, every vessel is going to do this. And headache is something that is a part of that. They can have excruciating headaches from it. I have, and I don't know if it's an old wives' tale or what, but I have done this, and it does work. Used nitro ointment and put it down on the thigh area, and change each day when I reapply. And it supposedly will decrease the headaches. And I think it's just the amount of absorption to get to that area, because we're down further. We have reflex tachycardia, postural hypotension, skin irritation and topical application, and tolerance may develop. Tolerance can develop with these drugs. And when that happens, they might have to have an increase, but instead of increasing these medications, what we like to do, or what the doctors like to do, is a timeout. So let's take the nitro patch off. Let's not give any nitroglycerin for 10 to 12 hours if the patient can tolerate, and then start again. And that just kind of resets that whole process of drug metabolism in the system. So these adverse effects are there, and it's so important that you understand that. So I always say to nursing, what can you do about a headache, or what do we want to do for our clients or patients? One of the things that you always want to think about is, dimming the lights, cooling the room, putting their head back a little bit, cool compresses on the head or the neck. You can give some Tylenol or ibuprofen per the order of the physician if they order that. But because of what the medication is doing, it's not going to ease that. We've dilated these vessels. So these are adverse effects. And for my students, ding, 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 something to look at. And I always say this, if you're reading something or see something and you really don't know what it means, look it up, take your phone out. Everybody has the phone, Google search that. It'll give you a definition, write it down and you'll know. Okay, tolerance, here we are. So it occurs in patients taking nitrates around the clock or those long-acting forms. Like I said, we can remove the patches at bedtime for 8 hours. I also read in another book, 10 to 12 hours if needed, and then reapply a new one in the morning. So, and that just resets the body, the system. Next question. A patient with a known history of angina was walking his dog and developed chest pain. The patient immediately stops walking and sits down. He continues to experience chest pain when sitting down. When should he call 911? A, immediately. B, if the pain becomes more severe. C, if one sublingual tablet does not relieve the pain after 5 minutes, or if the pain is not relieved after 3 sublingual tablets taken 5 minutes apart. The answer is C. If one sublingual tablet does not relieve the pain after 5 minutes. And I'm going to read this rationale to you because I'm going to go a little bit in detail with it. With sublingual nitroglycerin, the medication should be taken at the first sign of chest pain and not delayed until the pain is severe. The patient should sit or lie down and take 1 sublingual tablet. According to current guidelines, if the chest pain or discomfort is not relieved in 5 minutes after the first dose, the patient or family member should call 911 immediately. Because what we're thinking is you take one and it doesn't work, and this is an acute MI or an acute coronary syndrome, you need help immediately. You need to be getting to a hospital. So by the time you call 911 and they're en route, then you're going to give your second sublingual. Right after that 911 call or your family's doing it, go ahead, 5 minutes has gone by, take your second sublingual tablet. And after 5 minutes, you can take a third if the chest pain has not subsided. There are no more than 3 sublingual tablets under that tongue in a 15-minute period. No more than that. These guidelines reflect the fact that angina pain does not respond to nitroglycerin. When it doesn't respond, then it is possibly an acute MI. Now, it's occasional that someone might have chest pain, take the 3 and it doesn't. And I will tell you just really quickly, a little off story, is I had a gentleman come in and his pain did not subside after 3. And when I always ask my patients for their nitroglycerin tablets. I said, can I see your bottle? I took his bottle and it was so outdated, it wasn't even funny. So what he was taking was pretty much probably a sugar pill of some form. You know what I mean? It had no potency. You want to make sure, and we'll go over how you handle nitroglycerin, but that is an issue. So always take 1, sit down, stop movement. If you're having chest pain, take a sublingual nitroglycerin immediately. After 5 minutes, if the pain is still there, even a dull, you can take a second sublingual tablet or spray, but call 911 immediately. Then if by 5 minutes goes by and you're still having that discomfort, take your third sublingual nitroglycerin tablet while EMS is en route to you. So you'll have 3. And I will say this, if the patient or client is home, they can take an aspirin, 325 milligram, take an aspirin. And that's part of the whole protocol. And we'll talk about that when we talk about acute MIs. We're talking about nitroglycerin. So let's move on. How much nitroglycerin tablets should a client take? Once again, I reiterated this. So if I've said this 3 or 4 times, you should know there'll be a test question somehow. And plus you should know this. Take a dose sublingual after 5 minutes, no relief, call 911 and take your second dose. And then third dose can be taken after 5 minutes of that. No more than 3 doses in a 15-minute period. 1, 5 minutes, 2, 5 minutes, 3, 5 minutes, right? So 5 minutes, 5 minutes, 5 minutes. No more than 3 in a 15-minute period. Okay, need to know about nitro. I put these in here. It needs to be stored in room temperature out of direct light and away from heat and moisture. So if they have a little bottle that it should be in its original glass bottle. They're usually little dark bottles for a reason, because it breaks down in light. Also, do not leave it in your car, because what happens in the car? We have extreme temperatures. We'll either get really hot or really cold. So you need to keep it. And plus, let me back that up. They need to keep it on them, because if they have pain and they have that, it's apparent that they need it so that they can take it. Do not freeze or keep it in the car. Once again, temperature affects the medication. Always check the date on the bottle. Remember your 3 checks when giving a medication. If you're giving sublingual nitroglycerin, you'll get a little bottle. And if that's the case, you want to do your 3 checks. What are our 3 checks? We're always looking at is it the correct medication? Do we have the correct medication? Are we, is it in date? You know, is that correct? And is it the right patient, right dose? We do our 6 rights, but always checking that bottle to make sure it is the correct medication and that it is current, that it is not outdated. Do not chew, crush, or swallow the sublingual nitroglycerin unless it is made to do that. If you're giving medications that it is made for that, then by all means. But the sublingual tablets are not made to chew, crush, or be swallowed. Do not eat, drink, smoke, or use chewing tobacco while the tablet is dissolving. So I'm just going to say this. If I have a client, a friend, a patient, anyone that's taking nitroglycerin for chest pain, they don't need to eat or drink, smoke, or chew tobacco to begin with till they are seen or things are better. Because if they're having issues and have to go to the cath lab once they get to the hospital, I don't want them eating or drinking. Smoking or chewing a tobacco product is a nicotine, which is a vasoconstrictor. The whole point for us giving nitroglycerin is to dilate and open things. Why would we want them to close it back down? So, and let it dissolve. Now, if the chest pain subsides and life goes forward, then maybe a sip of something or whatever. But I'm an NPO girl all the time. Oral spray, it's very similar to the sublingual. It goes under the tongue. You want to always recap the bottle and store it upright. Do not dispose near a fire. Remember, nitro will go boom. Remember, you know, that's how we blow up things. So you don't want to throw an empty bottle into the fire. You don't want them to do any of that. Put the cap on, store it upright, doesn't need to be laid down. But we also don't leave it in the car, extreme temperatures, make sure the date's correct. All the same with the sublingual, but you do the spray, which is kind of nice. The dosing is the same, 3 doses max, a dose every 5 minutes for up to 15. And if there's no pain relief after the first, yes, call EMS, call 911. Okay, Iserdil, we're going to look at this. It's available in a rapid-acting sublingual tablets, immediately released tablets, and long-acting oral dosage forms. So they have different ones that we can give. It produces more consistent, steady, and therapeutic response. And that's why we have it, because some people need that steady, longer therapeutic response than someone in an acute situation that needs a quick vasodilation. So Iserdil is your drug that you might see. And then we pop back to nitroglycerin. It's the most important drug used in the symptomatic treatment of ischemic heart conditions such as angina. We can give it PO, sublingual, meter-dosed aerosol that is sprayed under the tongue, IV and topical. Large first pass effect with oral forms, and we need to understand that. Bypass it if you can. Used for symptomatic treatment of ischemic heart conditions. That's why we're giving it, is for angina, chest pain. And the IV form used for blood pressure control and perioperative hypertension, treatment of heart failure, ischemic pain, pulmonary edema associated with an acute MI and hypertensive emergencies. So there are times that we're going to hang a bottle of nitroglycerin, in layman's terms, we're going to hang a bottle of nitroglycerin for blood pressure control. It's either we have perioperative hypertension, or we have heart failure, you know, and we need to help offload some of the workload, ischemic pain, pulmonary edema associated with acute MI, and hypertensive emergencies. So we don't just give it for a heart attack. There's other reasons and times that we use it, and I wanted you to see those. Okay, that is our just general, what is nitroglycerin, nitrates, and what we do, how they work, what they are. Now, one of the things that I want you to remember, and you'll see this in the review, test review, is that when you're doing a nitro patch or paste, you will get a little packet of nitro. All of it is to be used. There's paper that you put it on, but if you read that packet, it will tell you how much is in that. And that is normally the dose that is ordered. So lots of people want to just put their little strip and measure it and say, this is all into give. But if you read the packet, it will tell you exactly how much is in that. And it's usually the dose that's ordered. So use the whole packet on that, just and put it on the patient. Make sure on patches and ointment, if you're applying, always to date, time, and initial, so that anybody that comes in knows when you put that on. And the other thing I want to say is if you're removing those or applying a new one, always find the old, take it off, and cleanse the area gently from the ointment, and then apply in a different, rotate your sites. It is very irritating to the skin. Never keep putting it in the same place, but always make sure you remove the old. I have gone in to take care of clients down the road a long time ago, and they would have 3 and 4 patches, pain patches, different patches on them. And so you need to remove that, clean that area gently. It's not a scrub. We're not scrubbing the floors. Gently pat dry, and then reapply in a different area. Rotate your sites. Sublingual, make sure it's in the container. We know that it breaks down to light temperatures, so it needs to be controlled. It should be with the client at all times. If they carry it, put it in their pocket, have it somewhere. And so if they need it, they can use it. And when we're giving nitro, once again, I want you to remember, first dose sublingual spray, 5 minutes, pain still there, call 911. Give the second dose, 5 minutes. If you still have pain or discomfort, then you can give a third dose. No more than 3 doses in a 15-minute period. You stop at that point. They need intervention if they're still having severe chest pain or discomfort, or even a mild. So I hope this helps, and I will talk to you again soon. We'll look at beta blockers.